Every beat of your heart depends on a steady supply of oxygen-rich blood. But what happens when the very arteries responsible for feeding the heart begin to narrow and clog? The heart may continue working for years without obvious warning signs, but gradually it starts receiving less oxygen than it needs. This condition is called coronary artery disease, and it is the most common cause of heart attacks worldwide. So what exactly is coronary artery disease? Coronary artery disease, often called CAD, occurs when the coronary arteries, the blood vessels that supply oxygen and nutrients to the heart muscle, become narrowed or blocked. This usually happens because of a process called atherosclerosis, where fatty deposits known as plaques build up inside the artery walls. In a healthy artery, blood flows freely to the heart muscle. But as plaque accumulates, the arteries become narrower and less flexible. This reduces blood flow, especially when the heart needs more oxygen, such as during physical activity or stress. In the early stages, coronary artery disease may cause no symptoms at all. However, as the narrowing becomes more severe, a person may develop angina, which is chest pain or discomfort caused by reduced blood flow to the heart. Some people also experience shortness of breath, fatigue, or discomfort in the shoulders, arms, neck, or jaw. The most serious complication occurs when a plaque suddenly ruptures. The body responds by forming a blood clot around the rupture. If the clot completely blocks the artery, blood flow to part of the heart stops, resulting in a heart attack. Several risk factors increase the likelihood of developing coronary artery disease. These include high cholesterol, high blood pressure, smoking, diabetes, obesity, lack of exercise, unhealthy diet, and chronic stress. Age and family history can also increase risk. The understanding of coronary artery disease has improved significantly over the last century as scientists studied how cholesterol, inflammation, and blood vessel damage contribute to heart disease. The good news is that CAD is often preventable and manageable. Lifestyle changes such as eating a heart-healthy diet, exercising regularly, maintaining a healthy weight, and avoiding smoking can significantly reduce risk. Medications may also be used to lower cholesterol, control blood pressure, and reduce the risk of blood clots. In more severe cases, medical procedures such as angioplasty or coronary artery bypass surgery may be needed to restore blood flow to the heart. Today, modern technology is helping us detect coronary artery disease earlier than ever before. Artificial intelligence and machine learning are being used to analyze heart scans, identify plaque buildup, and predict cardiovascular risk. These tools help doctors make faster diagnoses and create more personalized treatment plans. Coronary artery disease develops slowly, but its consequences can be life-threatening if left untreated. Understanding how it affects the heart highlights the importance of prevention, early detection, and healthy lifestyle choices to protect one of the most important organs in the body.